When do you believe EMDR becomes appropriate for an addict in treatment? Um, for instance, can you define maybe some criteria and guidelines clinicians should consider before presenting EMDR into the therapeutic process in an addiction treatment setting?
Well, there are a lot of factors that go into that, Steve, and it's actually a very sophisticated and complex issue and hard to discuss in a matter of a few minutes. In general terms, I would say there's going to be a spectrum of cases. There are going to be some people where, for a variety of reasons, which I'll touch on briefly, you probably will need to wait a little while, and at least for the standard protocol. With others, you're going to be able to begin and need to begin sooner. So what are some of the factors? Well, certainly first, if they're in the middle of heavy detox, that's not the time to increase the level of their distress, even in the short term. So people have to be medically stable, first of all, and not going through intense cravings. Secondly, you have a lot of other general readiness criteria that are used when you are considering EMDR. Have you screened for a dissociative disorder? If you have some type of a dissociative disorder, you're going to need to modify the way you're approaching with EMDR. There's work that's being done in Europe examining this question. Some pilot studies have been done with some slightly modified EMDR protocols in early phase recovery from severe alcohol abuse, showing that EMDR can be used in early phase residential treatment programs to decrease relapse rates. And so again, it's going to depend how soon is the client ready for that, and clinicians need a lot of experience to make that determination. So clinicians early trained in EMDR will need to consult with approved consultants to help sort that out. But a lot of people will be ready early on. You have the standard protocol for treating the PTSD, and in some cases that's going to be appropriate. Other people aren't being troubled so much by their PTSD symptoms. They're really being troubled more with just severe urges to use. And there are modified EMDR protocols to target the urge to use itself that are showing promise in early trials. And those modified approaches can be useful in early phase recovery where people are struggling with the urge to use. Maybe we're not going to be treating their trauma. We're going to be treating their compulsions, treating their urges. And that's also true for other addictive compulsive behaviors like compulsive gambling, compulsive spending, which are sometimes co-occurring with substance use disorders. The same is also true with eating disorders. EMDR has a role with eating disorders, and you sometimes find eating disorders co-occurring with substance use disorders. So when EMDR becomes appropriate and which EMDR protocol becomes appropriate is a complex question. And there are a number of protocols that can be considered and a lot of research that's going to need to be done to demonstrate which protocol is right to use at which time.